continue our usual reputation for promptness. Good afternoon. Welcome to the December 1st meeting of the Cape Cod Regional Government Assembly of Delegates. And I'll call this meeting to order, and we will begin with a moment of silence to honor our troops who have died in service to our country and all those serving our country in the armed forces. Thank you, and now we'll stand for the Pledge of Allegiance. Clerk will call the roll.
Richard Anderson.
Here.
Ronald Bergstrom.
Here.
George Bryant. Leo Kakunis.
Here.
Christopher Kanega.
Here.
Thomas Keys.
Here.
Marcia King.
Here.
Thomas Lynch.
Here.
Teresa Martin.
Here.
John Oman.
Here.
Paul Pilcher. Anthony Scalise. Fred Schilp.
Here.
Charlotte Strebel.
Here.
And Julia Taylor.
Here.
Mr. Speaker, we have a quorum with 94.22% of the delegates present.
Thank you. I'll now need a motion to approve today's calendar of business.
So moved.
Second.
Moved and seconded. Any comments or additions? And hearing none, all those in favor say aye.
Aye.
Opposed? Now, you should have received a copy of the Journal of November 17, 2010. Any additions or corrections to that journal? Do I have a motion to approve the journal?
Mr. Speaker, move to approve the Journal of November 17, 2010 as submitted.
Moved and seconded. All those in favor say aye.
Aye.
Opposed? Okay, and now we move to one of our favorite sections of the agenda, the communications from the Board of County Commissioners. Yeah.
It's always a pleasure.
It's always a pleasure. We do expect Sheila.
Okay.
I think she will be here. You may notice that I just dropped off a proposed ordinance. Yes. This is for funding for legal services to deal with the wastewater issues. The commissioners voted to hire the law firm of Anderson and Krieger, and so the Cape Cod Commission is actually supplying half 50,000 and 50,000 from the county as it's sort of a budget, not we're paying it out. It's just to have the money on hand as we proceed. We expect that we will be working with the member of the law firm who receives the lowest fee, in the beginning, and that we will only utilize the high-end attorneys at certain points, perhaps. We don't expect this to be a very intensive type of relationship with the firm. Very specific things. They will be, we have a litigation management team that has been formed, who actually reviewed and met with the principals of Anderson Krieger, and we went over exactly with them what we expected from them and what we had hoped to be able to accomplish with this. The whole idea is to have the counties working through the commission regional wastewater management plan, one that can hold itself up to the Clean Water Act and to any other federal or state regulations that either exist now or may exist in the future. So that's what that's about.
Do we have a number for this ordinance?
Not yet.
Not yet. Okay.
Not yet. Okay. First thing I want to do is, I hope you had a very happy Thanksgiving, and invite you to our Christmas holiday luncheon on December 22nd at noon in rooms 11 and 12. It's always a nice event. Lots of people come. And certainly the DA's office comes, the registrar's office comes, anybody associated with the county, extension, everybody comes. So you should come too, and you'll have a good time, and the food is excellent. Today we met with Beth Albert, who's our Human Services Director, and she gave us updates on the really difficult situation the whole county is facing in terms of housing, not only affordable housing, but housing for people in need. And the county has received a grant a year and a half ago that was significant in being able to coordinate all of the agencies on the Cape that provide services to people who are in need. And that grant just ran out, I think it was September 30th. And there is no other money forthcoming that we are aware of. And whatever monies all of the agencies have is being dwindled down considerably. The cost, this all came about too from the creation of the network, and really looking positively at how people who were in need of shelter could be taken care of. And it turns out that it costs $1,500 to put a needy family in a home or in a shelter, wherever that might be, as opposed to $15,000 over the same period of time to put them in a motel. I've got that wrong?
No, it's $15,000 for 90 days in the rest of the state. It's $1,500 a month for the support that they get on the Cape. So there's a substantial difference in the support that the Cape has organized to give, which is, in my mind, at a much higher level of quality than you would get in the rest of the state for the additional amount of money.
Actually, this is Bill's forte, so he should really be talking about this anyway.
Oh, not at all. You're doing a great job.
But I think the other piece to this is that the Department of Housing and Community Development, DHCD, is putting out an RFP very soon for all of the agencies that deal with the homeless. Our able director has decided that they've already put together what their response is going to be to the RFP. They're all ready. Once it comes in, all they have to do is, put the words on the paper. But they are also including in there some matching monies, which is not required under the grant, but hoping that that will give them some bonus points that might help. There's $1 million available. There's 10 agencies around the state. So if they just, parcel it out equally, all we would get would be $100,000, and that doesn't go too far, particularly at this time. But just to keep you up to date on where we are with that. Beth has also taken the lead on a very serious crisis in terms of suicide that has developed in the town of Falmouth. Falmouth has had 7 suicides since September, and 10 total since January. And Beth convened the Suicide Coalition group in Barnstable, and principals from Barnstable who have been very active in that coalition, the president of the council, the members of the police and fire department of Barnstable, along with all of the people who represent agencies that support people who have issues with mental health. And a lot of Falmouth people attended that meeting, as did I. And from that, Falmouth set up its own suicide coalition team. And we've met twice, and we're meeting again Friday with the Department of Mental Health people, the Samaritans, all of the agencies are being represented to help in this. We've done some, I think, very good things. We've sent a letter out to the community about this and about the crisis and how to respond. We've come up with what the resources are that are available, that they've been published in the local paper. There are a lot of other things going on of a very proactive nature. And I just want to say that you should be very proud of our Human Services Director, because Beth really has taken the lead on this and has really helped the community, as Barnstable was helped when this happened in Barnstable just a few years back. So I just wanted to update you on that because, and interestingly enough, it's the suicides, all of them have been white males between the ages of 40 and 55. So, you know, you can't really say what it is. We all know that sometimes or mostly suicides come from issues with substance abuse of one kind or another, with financial problems, and also with broken relationships. So, but you can't really say, and nobody probably knows for sure what precipitated this. And then, of course, we had the terrible news about the sheriff of Middlesex who took his life, and who knows what really prompted that. So it's not a very good situation, and I think when it hits a town as seriously as it has in Falmouth, it's great and wonderful to know that there are so many resources available, not only to the community to help deal with it, but also to offer those services to people who really are in need, and to train. And there's a training session. It's called QPR.
Like CPR, only QPR.
And so that, and with bartenders, I know they've been reaching out in town to bartenders to help them kind of see and understand if someone's issue maybe might be drinking or just being alone and wanting to socialize, that to train them to know when to say, are you really thinking of hurting yourself? I mean, questions like that, where before, no one ever wanted to ask the question. They thought it was too personal, or that they were interfering in someone's life. But in reality, it's important to ask that question and get people help. So,
Mention the grant, you know,
yes, one issue that keeps people who are in need like that from asking for help is to see a mental health counselor or a psychiatrist or a clinical psychologist. There's a copay. And if the issues are really financial, the people in need don't call because they're not able to pay. Now, Falmouth Human Services Department, if the call goes to them and they see the person almost immediately, and if it's an issue of copay, they will waive it. But that isn't always the case. So we voted today to have Human Services have access to a $2,000 pool that could be used after it's developed. That the whole process hasn't even been developed yet, but when it is, and if it seems, pardon me, helpful, that they would have that source to help pay for those copays that people can't pay for. We also approved today the RFQ to do the assessment of county operations, county services. 8 people actually responded to the RFQ, but only 2, called and asked about it and asked for the scope of services, but only 2 people really responded. And so we voted today to award the agreement to MMA Associates for a fee of $9,800. So that isn't really too awesome when you think about it. And the scope of service is really to take a look at what we're doing, what services are we providing, what are they cost, how long have we been providing that service, and through interviews with department heads, is that a service that should be modified in some fashion, maybe added on to, or should it be modified, maybe not doing it as often or not doing it at all? And getting data on, even data on county employees in terms of how long they might be here, when they'd be eligible for retirement, because when you have key people who leave, that's huge. And so you need to plan ahead, you know, the old succession planning, being prepared so that you know what you want to keep really qualified people in the positions. So that's part of it. And then the final part of it, of course, is making recommendations based on all the data as to how the county can regionalize in some fashion, how that information will help us know what direction we need to take. I was hoping Sheila would be here to give you the update on the Vegetative Management Committee, you know, the group that's working with NSTAR. And some of you may know from your towns that...
Leo could probably talk about it.
Huh?
Leo could probably talk about it.
Oh, yeah, Leo could talk about it. There's a request circulating to ask towns to vote resolutions regarding the cessation of using pesticides. And I'm not going to go into the whole issue. I'm sure, Leo, are you on the Vegetative Management Committee? So you probably know more of what's happening. But there's been a very thorough review. And it isn't just NSTAR. You know, it's every homeowner and what they put on their lawns. And it's a whole lot of other people just besides NSTAR. NSTAR actually follows the regulations, the feds and the state. But of course, individuals don't. Did you want to say something? Did you want to?
The only thing I think at this time that I'd like to say, just to remind everyone, that NSTAR did a voluntary no spraying for a year. They did that for two purposes. One is to allow the Cape Cod Commission to help update the maps on not only municipal wells, but private wells, which may be within a 100-foot buffer of their right-of-ways. It came to the realization that, especially on the outer Cape, that there were a lot of wells that were not even on these maps. So they decided to voluntarily take a year moratorium to allow the Cape Cod Commission to put together and update the maps specifically on wells. Within that year time frame, the county, I guess it was your board, formulated this committee in which I sit on to review what NSTAR is doing, to take testimony from not only NSTAR, but the Department of Agriculture, which is the pesticide board for the state of Massachusetts, and also there's members there from the NRCS and from the USDA, and there are members from Green Cape. So we've been meeting bi-weekly, and we've been receiving testimony from all these organizations. It's my understanding that there will be some conclusion this month in which we will be somehow wrapping up our findings. And I can't say any more than that because no vote has been taken. But I believe that that is going to be the outcome. We have a meeting this Friday, and then I think the final meeting will be 2 weeks from that date. And at that time, we have to come forward with some kind of resolution of where we're going to go from here. So just to let you people know and go back and update your towns.
Thanks, Phil.
Dave Simser.
Go ahead.
I'd just like to note that Dave Simser, who was known as affectionately as the Tick Man, who did so much important work with regard to the study of Lyme disease here in the Cape, has passed. There had not been an obituary in any of the papers, so you may not have been aware of it, but he passed about a week ago. And I don't know how we're going to replace him. He brought a passion and interest to the county and to the job that made a significant difference. He had been recognized recently with an award from, was it the state? Mm-hmm. From the state for his contribution to this, was it? DEP, for his work with regard to it. So it's very sad. He was only 57, and he will indeed be missed. He worked at the Cooperative Extension.
Okay, is there any questions for the commissioners on these issues? Yes, Julia.
Not so much a question, but a comment about the mental health issues. I think people need to realize that, for example, in Falmouth, there is not a single psychiatrist, even though we have a hospital. But that's not to say everyone who might have a problem that could conceivably lead to suicide needs a psychiatrist. There are other professionals, but that's a pretty serious situation for the whole end of the Cape. The only psychiatrists that I know of are in the Hyannis general area, and there's, this is a health problem for the whole Cape. If you wanted to get an appointment with a psychiatrist, you probably couldn't. Even if you had the copay, even if you were willing to pay cash, you might have to wait several weeks unless you were admitted to a locked hospital ward. That's a pretty bad state of affairs for a first world country.
Okay.
I'd
Tom?
like to respond to that,
Oh,
if
sure.
I may. What Julie says is absolutely accurate. However, there are licensed psychologists and therapists who are in a position to be helpful. Psychiatrists, unfortunately, on the Cape have been relegated to the role of providing medication and overseeing medication. So this has been a problem not only in the Upper Cape, but also in the rest of the Cape in terms of the availability of psychiatrists. We have not been able to recruit let's say, what I would call the population of psychiatrists that would be adequate to support the mental health needs on the Cape. And this has been going on for several years. But having said that, the thrust of what Beth Albert was trying to do was to suggest that if someone was at that stage of depression or suicide ideation and was, let's say, impeded from reaching out for help, that we would help with the copay. To go to right now, the emergency wards at Falmouth Hospital and Cape Cod Hospital are the ones that act as a gatekeeper to a great degree for people who are at that what I'd call a precipitating stage. The issue with regard to the nonprofits who engage in mental health services are not really prepared to, let's say, to respond immediately to an emergency request, and that's why the ERs have been that. And because of the issue of copay, we thought, or Beth thought, that it would be useful to tell people, we will help you with that first visit, and with that evaluation, perhaps that that next step, there could be a what I'd call a modality of care that would lead to a successful avoidance of this very terrible thing.
Okay, Tom, did you have a question?
It's interesting because the suicide prevention model that Barnstable's been using for the past couple of years, you'd like to see a regional response, but in our instance, it was more young school-age children, and Falmouth, as you've just pointed out, is a different sort of problem. So I think it's an area where Beth has been active in participating and taken the best practice and applied it in Falmouth and other towns. You may want to, it's all about prevention, so it's getting out there in front of this. Question on the legal ordinance that is before us, and probably not for answer now, but when we get to the public hearing stage, I'd be interested to know is if we get sued, then does the insurance policy kick in? Right now, I would assume you're using legal reserve. It's coming from the legal reserve. After that point in time, would it be more from the insurance that we have? And I was going to say that there was a story on the Tick Man in the Sunday paper, which was very nice. It hasn't been an obit, I agree on, but very nice story on him, I thought. And finally, on the NSTAR, the non-binding resolution, the Barnstable Town Council voted 11 to 0 to 2 abstentions to support the non-binding resolution. Their thinking being that some areas don't have town water. They don't want to take the risk of any sort of pesticide being sprayed at this time. Followed on the heels of a Silent Spring Institute session that we had at Barnstable Town Hall for the Cape. They keep talking about emerging contaminants. They talk about being able to test for these chemicals that you weren't able to test for even a few years ago, and that are showing up in our water supply. And I think it was the town council saying, look, if it's not a matter of cost, if it's not going to, that's not the issue for you, we'd rather see clear cutting than putting down any sort of pesticide at that time. So that was just the Barnstable's position on that.
To get to your first question about, not question, but comment about the suicide, the task force, I guess I would call it, that Falmouth has put together. Well, first of all, when we met with Barnstable, Fred Chiragardis was there. All the people who were there in developing the original plan. And I think what we learned, too, from that, even though the Falmouth situation is different, most of the people had children. So the school was very much involved in this task force, the school superintendent, the chief guidance counselor, I guess, or whatever his title is for all the schools. And they are looking, too, at ways in which they might be able to use a screening process similar to what Barnstable used, so that children are included in this as well. So, and we already talked about it, but if you wanted to comment on Tom's.
Tom, are we referring to a resolution that was brought before the town council to ban, and it was voted, it was approved? Yeah, 11 to 2 to 0. I mean, and I think this is all well. I mean, it's sending a signal to the state, because the more we're on, peeling off all of the layers of this onion, the focus is on NSTAR, and actually NSTAR has changed from clear cutting, because they were having a lot of problems with the regulations of the National Resource Department. Because by clear cutting, they were destroying many natural habitats, in endangered species, as far as flora, fauna, that sort of thing, and wildlife habitat. So, and to look at their practices, they adopted this. This is actually an award-winning vegetation management practice that they are doing, and even though they're going by the letter of that, and I sound like I'm defending NSTAR, but I'm trying to just put clarity on the issue. They are more than willing to make compromises and to increase their setbacks and this sort of thing. I think that they would be more than willing to do these types of things to be that much more to give that much more assurance to people that they're not near their wellheads and near their homes and their properties. However, at this task force meeting that we've convened here at the county, we have stakeholders from across the Cape. We have the golf courses, we have landscaping, we have the base. There's municipalities use pesticides on their, taking care of their lawns and their greens around. And so the layers.
Just be sure, Barnstable doesn't. All our golf courses, we don't use any pesticides. So there are other methods, but
I agree with you. I'm not saying that there isn't. This is really a learning. This is really learning, and what we're trying to do is put everybody at the table of who does this. And say we take NSTAR out, it does not solve the problem. And now that the focus has been on the groundwater, and they got my attention on all of this. It is a problem, and it's a problem as much for the homeowner as it is for anyone else, because as we all know, when we're out there in our yard in the spring or whatever, and we have our Roundup, that weed looks pretty tough. Maybe just a little bit more will ensure that it's gone, and more does not create better. And so I think that there's going to be a big education process. But it points more and more, and people have said this to me from being in the public audience and the participants, it's really the regulations of the state, how the monies they have to review the pesticides that are now being used, they have to be updated, and that because of funding and the log jam there, that is not being done as quickly as we would like, because I'm sure some of those are outdated now, and they'd have a better alternative. And it's also, stems from the federal government. The federal government brings their regulations down to the states. Massachusetts has the most stringent regulatory process on pesticide use in the country. And yet, even that, you can see they're allowing certain pesticides, but they feel that they have scrutinized those and scrubbed all of the details of that that much more. So, to me, I feel that and this is preliminary, but the onus is on the state. How can we have the state change, and how can we have legislation that will give us the right to control these pesticides here on the Cape, whether it be town by town or by a region? Where can we get that legal authority to be able to regulate it? And that's what I would like to see come out of this.
Anything else? Yes, Marcia.
Thank you, Mr. Speaker. I actually want to ask a question about Open Cape. I just found out, I know it's late, but that RCN is not the contractor, that they have withdrawn and that they are rebidding. I guess I was really quite surprised, and when I asked a few other people, most other people didn't know it either. Not that we necessarily should. Can we get a status on what is going on? I know that there was a very tight timeline with all the money that they have, and so I guess I was just a little concerned that it was so hyped and there was the big presentation and everything in the spring, and what is going on, if you can.
We have a board member of Open Cape.
You go ahead, I recognize that, Therese.
Okay, what happened with the RCN relationship is that the NTIA, as the grant process went along, was reshaping the exact specifics of how contracts could be done, and they found that it didn't fit quite into what they wanted to see, and so they asked that it be re-put out. An RFP had been posted. The responses were in, interviews were held on finalists, the whole appropriate documented RFP process has happened, and they're in the final stages of recommending a new selected company. And so the timetable has not been impacted. The environmental work and other kinds of work that had to happen in advance had been proceeding as planned. Yeah. Yeah.
Okay. Pat, the ordinance you just presented to the Assembly, we're having an awkward stage now. We only have one more meeting before the end of the year, and then the Assembly dissolves and the committees dissolve. I mean, if this were gone before the Finance Committee, then they would disappear. In other words, this will have to be presented, unless if this is something that needs immediate attention, we could probably hear it and vote on it in this Assembly. If not, it's going to have to be done in the next Assembly, the committees are not going to be appointed unless they're appointed by the incoming Speaker until the middle of the month.
We think it would be best passed by this Assembly.
Okay, so then I'll have to get the acquiescence of the members who have sometimes objected to the committee meetings and the Assembly the same day, but I don't think that'll be a problem with this one. Okay? That's going to be, we're going to have to discuss that in another matter that's coming before us. But the other thing is, I know that Beth has a lot on her plate, but as Julie said, there's a lack of psychiatrists. I mean, if you want to get a knee operation, you have 5 choices. If you want a primary care physician, you may have to get on the phone for a couple of weeks. I've known people, so there seems to be a spotty distribution of care in some regards. I mean, we brought up the fact of psychiatrists. Has anyone looked at this? The health of Barnstable County, I know it's a big issue in the Outer Cape, can be a big issue in the Outer Cape and so on. Has anybody looked at this to see what kind of medical care is available on the Cape? I know a lot of physicians prefer to be in Boston, so there's an issues with getting people. Do we know? Are you on top of this, Bill?
I would hardly say I'm on top of it. However, I would suggest to you that the Department of Mental Health has been pursuing this issue for some time. Okay. Some of the agencies, for example, Cape Cod Behavioral Services, have been looking at how can they support the continuation of psychiatrists, and that would be on the Middle Cape. I think that Cape Cod Healthcare had had made an announcement that they were pulling out of Falmouth, but there were no psychiatrists that were part of that. That was just, counselors that were there. The Cape Health Care clinic that is in Mashpee, that I think used to be in Falmouth, is where Moral Weir is housed, but they are really not in a position to, let's say, to expand to meet this, what I would call this, this immediate crisis. But the issue seems to be the ability to recruit a psychiatrist that would be able to afford to live here, and that Cape Cod Healthcare and other providers could afford to keep on staff. That has been a problem that has existed for some time. I believe that, that Tom and I, when we were back on Citizens Advisory for DMH, had this conversation, and we're facing the same problem, and it comes down to where do you find somebody that that is willing to take what can be afforded to be paid, and and continue.
Yeah, I don't want to make too fine a point on it, but that recently it came up the issue that all small airlines, for instance like Cape Air, are subsidized by the federal government. In other words, they feel that this is a need and that small communities can't support air traffic, so that the government steps in and they give them a little front end.
If you can find Bill Keating, why don't you ask him that?
Well, but I'm just saying is it may be, just throwing this out, that it may be that communities such as ours simply can't afford to support on its own
we can't.
psychiatry, but we need them.
The answer is correct.
So that we're all going to get on that. We're all going to get on that.
If I can, we have a meeting Friday morning. It doesn't have a name. It's a group of community people who've come together to try to help
we'll call it the group
find
with no name.
Find solutions to this issue, right? Call it what?
The group with no name.
The group with no name. But the Falmouth Hospital does have a director of behavioral health, and I don't know, he's on this group with no name. I don't know exactly what that means at the hospital. But I know when I did my psychiatric nursing, which was a number of years ago, we worked a lot with clinical psychologists too. And their PhDs, like psychiatrists in a way, are PhDs when you think about it, or probably beyond that. But the ones that I always came across were very, very good. And the big thing is that they probably still can't write prescriptions. I don't know if that's the case today. But I know, and I don't know what the status is of clinical psychologists in the area either. But I'm going to bring this up Friday and at our meeting and see what response I get.
George?
You may be interested to learn that in the 40s, 50s, and 60s, a lot of New York psychiatrists came to Cape Cod, especially to Truro, Provincetown, and Wellesley, and they would bring their patients with them. And they'd rent big houses and have a wonderful summer. I don't know. I remember in particular Dr. Clara Thompson and Shandor Rado, who was originally from Hungary, and quite a few others who would service not only their patients but other people on the Lower Cape. Once at the Provincetown Art Association, the psychiatrists got together and discussed the subject, and Dr. Rado threw his arms in the air and he said, "We must remake men's minds." So there must be a way to get psychiatrists here in the winter, and perhaps you could work on that.
Well, we also have the Bocasset Mental Health Facility over there, and I think that's where our meeting is on Friday. And we can check into what the staff is there. I mean, that's been there for a long, long time.
There is a psychiatrist. It was Dr.
must be.
Laszlo. I don't think he's still there, but there was a chief medical, and that was a psychiatrist that was there. But that's in Bourne, but in Falmouth.
No, up the road.
Well, anything else from the delegates? Tom?
Thank you, Mr. Speaker. I think most of us here just received notice that the town of Falmouth, the planning board has, they're putting together, they voted, it wasn't unanimous, I think it was 5-1, to put together a letter that's strongly recommending the county put together a DCPC for the Upper Cape, Sandwich, Bourne, Falmouth, and Mashpee. It didn't say which agency or which body they were going to send it to. Do you know if it's the commission or the commissioners?
Brian Curry called me and gave me a heads up saying they were sending it to us. And in the phone conversation, because we haven't seen the letter, it was that we would be asked to sponsor a DCPC. He didn't say it was for the Upper Cape. I thought it was just for Falmouth. So now it makes a little bit more sense. It makes a little bit more sense that he's asking for an area. He's asking for looking at an area. So my response was that that discretionary referrals can be made by any individual town, and I would like to look at the letter before I commented further.
Well, thank you very much. And we'll see you at the Christmas party one way or another, maybe next couple weeks from now, too. Hey, are there any communications from public officials? Or any communications from members of the public? Anybody from the public? Okay. In that case, I will now convene the assembly, and we will have a report. Any reports from committees? I don't think we have any committee meetings that have not gone to fruition. A report from the clerk.
There will be a public hearing held on proposed ordinance that was submitted today by the commissioners for the legal services for shared cost and planning development. It'll be December 15th at 3:15 with the Finance Committee. And if you haven't already, the holiday party, December 15th, please give your money to Jenny today, if you're interested.
We also know the business. Oh, Fred, did you have something you wanted to bring up?
I'm sorry, these were just a couple of other pieces of business.
Yeah.
Is this appropriate?
Well, yeah, we're at other business, so why don't you, go right ahead.
Well, there are two things. I mean, one was we talked in our last meeting about some kind of memorial to Diane Thompson, and I don't know what we should do. I think we talked about forming some kind of a small committee to make recommendations.
I didn't pick up on that too much because forming a committee is sort of, I mean, it's more of a, if you form a committee, you have meeting times and so on. I thought that a few of us who knew Diane would get together. Okay. I'm sure that Julie knows Diane and myself and maybe a few other people who knew her would get together and come up with a recommendation for an appropriate memorial for her, rather than name a committee and so on. What do you think about that, Julie?
Yeah, I'm happy to work on it. Yeah, I'm happy to work on it with anybody who's interested, and we could probably do it informally.
Yeah, I think that's probably better than it.
I recall that. Charlotte, did you also want to be a part of that?
Yes,
too?
I'm still present.
Well, you're probably, I assume you're going to be present over the next several months, right?
Well, December.
Well, I'm not saying.
December, I'm through.
It should. Well, that brings up the point of several of us are not going to be here, but I think Charlotte and I think other people who are not going to be here would certainly hope that we could help pursue this this project.
Well, yeah, I don't think that we have to consider the formal machinations of the assembly on this one. Basically, we'll get together and we'll do it. Whether Charlotte's here or not, she's going to be, her opinion is certainly going to be welcome, and her advice going to be, counsel going to be taken.
And then the second thing was this DCPC that we talked about in the last meeting.
Yes.
Where a number of us, and I think our assembly person from Sandwich first brought it up. A number of us felt that it was a good avenue to look at how the Cape Cod Commission could begin to regulate the development of wind turbines on the Cape in the future. And I think there were a lot of people that I talked to before and after, and I think Julia's note today, that feel that a one-year moratorium on development would allow all of the towns across the Cape, similar to what we're doing with the ocean management project where we put together groups of people who can look at some of the issues and in particularly land-based wind turbines, so that we can come up with regulations that would work. And what are the plans to go forward with that?
Well, I'm going to recognize Julie first, and maybe she can help us.
Well, I did get a chance to speak to Brian Curry after I'd sent out the email, and he returned my call. And I think that he's already starting to, he called Bill, he's talked to the planners in Sandwich and Bourne, and feels that there is a fairly decent support for going that route. And it would require getting the local selectmen probably on board. Realistically, this is a political issue. There's pros and cons to regulation, and that's why we saw the regulations that came in, and that's why we voted against the regulations. There are some technical issues, of course, but it's political because it's policy. And I think it would be I think Brian Curry felt that it would be difficult for Falmouth to try and really come up with the technical work on its own, and would really like to have a DCPC so that the commission would be the lead on the research. And so I would really love to see that go forward. If the commissioners if the commissioners as a group don't support it, then I don't see that they're more likely to support it if we tried to go forward with it as a group. I think they'd be more likely to support it if they were lobbied by their town selectmen and planning boards. So I think that's a good route. I don't know how it'll play out, because we get it after the commission decides that they want to support something like a DCPC. So I'd like to see this play out myself, but I can see why people from other parts of the Cape might. But I think, as John pointed out to me, getting a Cape-wide DCPC might be more difficult to get support from the commission members and possibly from the assembly. So that's all I know at the moment. But
I disagree with you in one sense, because there's already been a big controversy in Wellfleet, and I think one in Orleans also. Is it? And so it's not. These communities are now in a position where they're being affected by this. They're looking for some regulatory structure, which right now doesn't exist, and we're waiting for the state to cough up whatever they're going to do. But it doesn't seem like it's going to be very restrictive. So,
one other point. I think that we know that some pressure is coming from the state, and there is this bill that did pass the House and is now in the Senate, which gives the state increased power over siting on the Cape. I do feel it's our responsibility, if we think it's better handled on Cape Cod, that we contact our existing state senators and our future state senator and have a heart-to-heart on this. I mean, this is, as I say, this is political, and that's where the push has to be.
Okay.
I mean, it should be. I mean, it should be political, but
my feeling,
we have to go forward with it.
My personal feeling is it would be less awkward if the DCPC was brought up by somebody other than this body, simply because we're the ones that ultimately will rule on it, and we don't want to go hand something to the commission that they're essentially going to hand back to us. Now, I'm not saying we can't do it, but it would be, to me, more politic if someone like Brian Curry, and if he could get in touch with some of the other town planners around the Cape, maybe we could come up with a more comprehensive. And I think it's in the commission's interest, is why would they do one in one part of the Cape, knowing that they're going to be presented one somewhere else down the road,
Well, it's clear to me, because of what was submitted to us, that the commission was not very interested in what we would have considered suitable and strong regulation. So we know that the members of the commission didn't want stronger regulation, because that's not what they voted for, and it's not what they then presented to us. So they need to be persuaded that there is an interest in regulation that is stronger than what came before us before. I think we need to talk to our commission members, we need to talk to our planning boards, we need to talk to our selectmen. If we think this is a pressing issue, and I do, then we really have got to get people activated. Because we know what, as of August, the Cape Cod Commission voted for what they submitted. And we didn't see that as adequate. So something is going to have to change their mind.
Fred?
Thank you. I did talk to our Churros member on the Cape Cod Commission this afternoon. I hate to speak for him for what he said over the phone, and I know their last meeting about this was an executive session, but I certainly got the impression from him that there was not a great deal of unanimity about the vote to go forward with what came to us. That there were a lot of feelings that that the detail was missing, and I think they were persuaded that the Cape Cod Commission had to have something in place to be able to do the technical work that had to be done. But I don't think it was something that they felt very strongly about. That's my impression from talking to him today. And I think, we are the regional government here. And I think this is a regional issue. And I think maybe it's awkward that we have to present something and pursue something and then vote on it. But it may be that we are the right people to tackle this, and maybe the commissioners as well. Maybe this is a
Well, I mean, it could be done. We'd have to write up the details of the submission. I mean, we don't have a staff. Falmouth has a staff, and so does the Cape Cod Commission. But we're just like we're kind of writing up DCPCs is not something I have long, vast experience with. But we could come up with it. It's up to the Assembly. If they feel that this body is the proper forum to go forward, then we would see what else is being hatched by the planner in Falmouth.
Well, I do think that we could probably do the same thing that most people do when they write up DCPCs, is go to the Cape Cod Commission and get their support in writing it up, right? I mean, that is what towns and other people do.
You're an optimist, Fred.
Okay.
Tom, did you have a comment?
Thank you, Mr. Speaker. My colleague just whispered in my ear, and he's right. This isn't on the agenda, so talking at length might not be wise. But I do want to throw 2 cents in. Just that I have spoken to multiple selectmen all up and down Cape Cod. I spoke to just a few planning board members. I don't know enough of them, but I do know most of the selectmen on Cape. And I haven't found any opposition to moving forward with the DCPC, because the DCPC is just hold on, put on the brakes so we know what we're doing. They're hearing from their residents, they're hearing from other towns that there's a real concern here. It's not we're going to stop wind energy or renewable energy. It's about make sure we have on the books what's going to protect our private property rights. And it's really not going to interfere with the municipal projects, the one turbines, because right now there's nothing to stop it anyway, whatever they have on the books. So the concern is incredible. As a member of the Assembly, nobody knows really what we do. We're kind of the shadow government. But the amount of correspondence and discussion that's happening out there, and I'm just coming, fresh off of a race, so I've been in multiple towns talking to a lot of people. This is a really big deal. Everyone's talking about this, and this is rather very new information. People haven't had an opportunity to really understand the impact of industrial-sized wind turbines encroaching on personal private property. And it's a real big deal, and I really think that we need to show, or at least, again, we are the final legislative voice on something that comes to us, but we need to show that we are also concerned, and that we should encourage the commissioners or the Cape Cod Commission to put something forward for us to review, whatever the parameters the DCPC should be. I think that's appropriate. It's a big deal. It really is. And I hope my colleagues would help support moving that forward also, and encouraging the county to put something forward. This is a big deal. It really is.
I'll make a suggestion that I'm willing to, at this point, willing to sit down with the executive director of the Cape Cod Commission and perhaps one of the commissioners, and we can discuss our options in moving forward with the DCPC, whether it would be countywide or whether it would be, I mean, as you know, we're not committing to anything, but we can find out at least what would entail, and whether we're willing to go ahead on it. And then I'll ask Leo what to do.
No, I take issue with you doing anything on this subject. It's not on the agenda. I think if my colleagues want to talk about it, you should put it on the agenda. Let's discuss it. I don't think it's appropriate at this time for you to take any action whatsoever on this matter.
Fair enough. But, okay, under other business, we have a ordinance before us on the enabling regulations for the Centerville DCPC. My inclination would be to have a public hearing in the new session in January that will be heard by both the committee and also by the full assembly. Then it falls within the time frame, 75-day time frame, rather than have I mean, December 15th is awful close to Christmas. I don't know, I assume we'll all be here, but it's possible we won't be. But so that's the only other thing that I have on the agenda. Anybody else? Yes, Charlotte?
Thank you, Mr. Speaker. If I may, I would like to acknowledge the fact that the delegate-elect from the town of Yarmouth is in the audience, Spiro Mitrakakis, and so he'll be coming in to the new session. So welcome on my part, Spiro.
Yes,
thank you,
Marcia.
Mr. Speaker.
Speaking of the new session, do we know who's going to swear us in, since we had a little kerfuffle with the clerk? So, well, he might have had a kerfuffle with some other people, but I just out of curiosity, do we have someone to swear us in? And thank you.
Well, I'm presuming that he's going to do that, but unless I hear from him.
I would not presume that.
Okay, well, I will. I'll find out if he's still willing to swear at us when I see him. Fred?
Yes, just back to this issue of the wind turbine. Can we put this on the agenda for the next meeting?
We can
put discussion.
We can put it on the agenda, and meanwhile, any one of us who wants to look into it and meet with anybody is certainly entitled to do so.
But we could have this discussion in 2 weeks. Okay.
Yeah. Is there anything else to be brought before the assembly?
Move we adjourn.
Oh, the second. All those in favor say aye. Aye. Opposed? Do you have that ordinance? Or do I have it? You have it.